Let's discuss face reading, diabetes. Diabetes is a series of metabolic disorder caused by hypofunction of the pancreas, insufficient insulin secretion, or the body's inability to effectively use insulin. The disorders trigger metabolic failure to deal with things such as sugar, protein, fat, water, and electrolytes. Typically, the clinical symptoms of diabetes are increased hunger, thirst, and urination and weight loss. Common symptoms also include dry mouth and a bitter or peculiar taste in the mouth. The onset of diabetes may be related to factors such as heredity, lifestyle disorders, microbial infections, viruses, emotional stress, obesity, and age. Face reading. Small red dots are often seen on the whites of the eyes in a patient with diabetes. The patient may look emaciated and have loose teeth that are frequently inflamed. They also feel numbness of the hands and feet and drowsiness. They experience a sudden rapid loss of vision and refractive errors. Diabetes patients in the middle and late stages have tongues that are stiff and inflexible. The tongue body is bulky and has teeth marks. The tongue is blue in color with the front part being light blue. There are red prickles located on both sides of the tongue. The coating is thin and white and there is little coating. So here is the illustration. Small red dots in the whites of the eyes and the other one teeth marks and red prickles on the tongue. Therapeutic methods. In addition to treatment by medication, patients with diabetes should be mindful of their diet, do proper exercises, maintain a healthy weight, and maintain a regular schedule of work and rest and a balanced emotion. Diabetics patients should always pay attention to changes in their weight and keep it under control. Dietary advice. The best dietary principle of diabetes is less oil, less salt, less sugar, and regular meals with a regular amount of food at fixed times. Limit the intakes of staple foods and fats and avoid sugary drinks, tobacco, and alcohol, strong tea, and coffee. Exercise. Do appropriate amount of aerobic exercises regularly and control your weight. Exercise should be done about an hour after a meal. Do not exercise while hungry. Emotional adjustment. Patients should learn to control their emotions, avoid being too stressed, keep negative emotions in check, and maintain a peaceful state of mind. Medicinal diet therapy. Salvia root, soybeans, and pork rib soup. Soybeans 100 grams, pork ribs 150 grams, salvia root 10 grams, some kohlrabi, ginger, and salt. Soak the soybeans in advance, wash and chop the ribs. Shred the kohlrabi and slice the ginger. Put all the ingredients in an earthenware pot, add some salt and cook together until they are ready. This soup can invigorate the spleen and moisturize dryness. Cupping. The Fisher point can increase thirst, the Fisher point can increase hunger, and the Shoe point can increase urination. Cupping the above acupoints for 5 to 10 minutes each once a week. Thank you for your attention.
Painful menstrual periods, interviewing. Apart from a slight discomfort, normally the period should be almost painless. The main areas of questioning with regard to menstrual pain are as follows. Time of pain. Pain before the period. There is stagnation of chi or stasis of blood. The latter is typically relieved by the onset of the period. For pain during the period, it's blood heat or blood stasis. Pain after the period signifies blood deficiency. Nature of pain. For severe stabbing pain, stasis of blood. Severe cramping pain eased by application of heat, such as a hot water bottle, stasis of cold. Mild pain, either blood heat or deficiency of blood. Dragging feeling in the lower abdomen with mild pain, sinking of chi. Feeling of heaviness in the lower abdomen with pain, damp heat. Pain on ovulation, damp heat. So we have here a tabulation of the symptoms and patterns of painful periods. For abdominal distension and pain before or during the period, the tongue will be normal or will have slightly red sides. The pattern is liver chi stagnation. For severe period pain, which is alleviated by the passage of clots, the tongue will have purple sides. Pattern, liver blood stasis. For severe spastic cramp-like menstrual pain that is alleviated by the application of heat, small stringy clots on bright red blood, feeling cold during the period, the tongue is pale, pattern, stagnation of cold. For painful periods with a feeling of heaviness extending to the sacrum, mid-cycle pain, small red clots, the tongue is red with sticky yellow coating. Pattern, damp heat. For painful periods, heavy periods, irritability, thirst, bitter taste, the tongue will have red sides. Pattern, stagnant liver chi turning to liver fire. Dull menstrual pain towards the end of or after the period, pain relieved by pressure, scanty periods, the tongue is pale. Pattern, deficiency of chi and blood. For dull period pain during or after the period, scanty bleeding, no clots, the tongue is pale and slightly swollen on the sides. Pattern, spleen yang and liver blood deficiency. Dull period pain during or after the period, scanty period, backache, dizziness, tinnitus, night sweating. The tongue will have no coating. Pattern, liver and kidney yin deficiency. Thank you for your attention.
Let's discuss Liuche or narrow defile as we continue our discussion on Han-Tai-Yin long meridian. Liuche or long 7 is located on the radial aspect of the forearm between the tendons of the abductor pollicis longus and the extensor pollicis brevis muscles in the groove for the abductor pollicis longus tendon 1.5 Chun superior to the palmar wrist crease. Long 7 is a luo connecting junction point with Li4, an exit point, an opening point of the renmai coupled with kidney 6, and one of Madan Yang's 12 points shining bright as the starry sky. This point is an extremely important point, a favored point when there is grief, sadness, and oppressive feelings in the chest, where these feelings have been held in and incompletely expressed. It can stimulate a beneficial release for the patient, often accompanied by tears. The pose reside in the lung, and long-term deep sadness and grief can afflict the role in the rhythmic, automatic maintenance of processes of life, leading to shallow or constrained breathing, tension in the area of the shoulders and chest, and uneasiness of the spirit. Being the opening point of the renmai, it can open the chest and affect the upper and lower jaw. Used with kidney 6, the coupled point, it tonifies skin, regulates the uterus, affects and moistens the throat, as well as stimulating the descending of lung chi and the grasping of chi by the kidney, and so it is useful in chronic asthma from lung and kidney deficiency, as well as edema of the face. The far-reaching effect of lung 7 on the upper jaw also supplies a nourishing influence to the heart and pericardial meridians. The nose is the opening of the lung. Lung 7 is said to open the nose. It regulates the lung chi and stimulates the dispersing of lung chi to circulate way or the defensive chi, opening the pores and stimulating sweating. This ability to release the exterior means it is often used in the early stages of invasion of exterior wind, colds, and flu. It is frequently combined with Li4 or Li20 in this context. These combinations may also be used to eliminate toxins from mind and spirit. The receiver of chi needs to have the clearest chi possible. Otherwise, all sorts of distortions can occur in the body, mind, and spirit, leading to depression, narrowed perspective, loss of purpose, and a constant sense of disappointment in life. As the best point to stimulate the descending of lung qi, it is beneficial in all types of cough or asthma. Being the lu or junction point with the large intestine, it can affect large intestine meridian as well as lung meridian problems, including neck, face, and shoulder problems, shallow breathing, oppression in the chest, as well as constipation. The lung and large intestine, as receiver of qi and drainer of dregs, are key in the beginning and end of life, in trances and exits. The low junction point has a harmonizing action on the internal-external relationship of this pairing. Furthermore, lung 7 is seen not just as a junction point for lung, but acts to regulate and harmonize the environment for all the officials to work within, because the role of the po in the automatic rhythmic maintenance of life. The lung controls the water passages. Lung 7 affects the opening of the water passages and is helpful in the patterns of urinary retention from deficiency, which often affects older patients. This point stimulates the descending and dispersing of lung qi. It also circulates wei qi and releases the exterior. For its indications, lung 7 calms and settles the po, opens the chest, and releases tension. It also is indicated for invasion of pathogenic exterior wind, cold, or heat, sneezing, nasal obstruction, loss of sense of smell, and it is also for channel problems and face pain, headaches along the LI pathway. It is also indicated for constrained qi in the chest, for upper and lower jaw disharmonies, and sternum pain and itching on the chest. This point is splendid at healing a migraine or the whole body lifeless with wandering pains when phlegm incessantly blocks above, or in locked jaw when you cannot force open the teeth. This important point is similar in effect to spleen 21, as it is said to be a special junction point which affects all junction points. Lung 7 helps maintain rhythm, one role of the po, and balance amongst all of the officials, effective for problems of the mouth, throat, head, and nose. Consider for constipation or retention of toxins, both mentally and physically, often combined with Li4 and Li20 for this. This point helps to enable the release of tears if suppressed by chronic grief and sadness. This point can be effective for heat and pain in the palm of the hand, for tension in the chest disorders with heavy mucus, or breathlessness. Thank you for your attention.
Let's discuss differential diagnosis, Western and Chinese medicine, myalgic encephalomyelitis. Also, epidemic neuromyasthenia, chronic fatigue syndrome, fibromyalgia. Number 1, Epstein-Barr virus. Letter A, acute stage, fever, sore throat, enlarged lymph nodes, drowsiness, loss of appetite, enlarged spleen, rash. Letter B, post-viral stage. There's chronic fatigue, unrelieved by rest, mild fever, sore throat, muscle, joint pain, mental fogginess, headache, insomnia, sensitivity to light. Number 2, human herpes virus, 6. Letter A, acute stage, fever, sore throat, swollen lymph nodes, sudden onset. Letter B, post-viral stage as Epstein-Barr. Number 3, influenza, acute stage, fever, headache, tiredness, sore throat, cough, nasal congestion, muscle ache. Letter B, post-viral stage as Epstein-Barr. Number 4, varicella or chickenpox. Letter A, acute stage, itchy, fluid-filled blisters of red spots on body, face and scalp, fever, headache, stomach ache, loss of appetite. Letter B, post-viral stage as Epstein-Barr. Number 5, gastroenteritis. Letter A, acute stage, abdominal pain and cramping, diarrhea, nausea, vomiting, excessive sweating, fevers, and chills. Letter B, post-viral stage as Epstein-Barr plus diarrhea or constipation. Number 6, non-viral causes include inherited genetic susceptibility, exposure to neurotoxins, immunization, traumatic and highly stressful incidents. Chinese differentiation, myalgic encephalomyelitis, also epidemic neuromyasthenia, chronic fatigue syndrome, fibromyalgia. Diagnostic questioning according to number 1, nature of fatigue or pain. Better for exercise is excess. Worst for activity, deficient. Severe fixed stabbing pain, worst at night, is blood stasis. Number 2, tongue diagnosis, thick tongue coating. There's dampness or phlegm, swollen, pale, thin coat. Spleen Chi deficiency, swollen, pale, bluish, moist coat. Spleen kidney yang deficiency. Number 3, background pathologies, residual pathogen, lung in interior, usually damp heat, or damp with yang deficiency, phlegm. Latent heat, there is incubation of pathogen inside body, turning to heat, later emerging to exterior. Lesser yang pattern, Xiaoyang residual pathogen manifesting as lesser yang pattern. Qi stagnation, there is stress from chronic illness, resistance to change. Number 4, etiology, persistent viral or chronic bacterial infections, over or under activity, too much, not enough rest, physical deconditioning, stressful situations, poor diet, emotions, social isolation, demoralization, frustration, depression, overachiever. Environmental pollution, exposure to chemicals, stressful situations provoke attacks. Number 5, Sangpu patterns. For the excess, damp heat in the muscles, heat in the interior, lesser yang pattern, stagnation of liver chi invading the spleen, blood stasis, phlegm. For deficiency, chi deficiency, deficiency of lung, heart, kidney, and or spleen chi. Yin deficiency may be empty heat, deficiency of lung, stomach, and or kidney yin. Yang deficiency, deficiency of kidney and or spleen yang. Thank you for your attention.
Let us now talk about Qi and blood relationship. The relationship between Qi and blood is that Qi belongs to Yang and has a warming action, while blood belongs to Yin and has a nourishing action. The relationship between them can be concisely summarized as Qi is the commander of blood and blood is the mother of Qi. The actions of Qi and blood are centered mainly on 3 aspects as follows. First is promoting blood production. Qi is very important in the process of blood formation. Both nutritive Qi and body fluids are principal components of blood, from digestion of drink and food and extraction of essence from them to transformation of this essence into nutritive Qi and fluids, and to further transformation of nutritive Qi and fluids to blood. Every step depends upon Qi and its movement and transformation. This is the reason for saying that Qi can generate blood. If Qi is abundant, its ability to generate blood is strong. If it is deficient, its ability to generate blood is weak, and this state can lead to blood deficiency. Hence, clinical treatment of blood deficiency often includes augmenting Qi. Next is powering blood circulation. The circulation of blood depends upon Qi. Most importantly, heart Qi provides motive force, lung Qi provides dispersion and depuration, and liver Qi provides conduction and facilitation. If Qi moves freely, so does blood. If Qi stagnation or deficiency impedes its movement, then blood flow is impeded by stasis. This is known as blood stasis due to Qi deficiency, or Qi stagnation leading to blood stasis. If Qi movement becomes erratic, then blood circulation follows the ascending, descending, entering or exiting of Qi and shows erratic behavior as well. For example, if Qi ascends inappropriately, blood also rises inappropriately, producing such symptoms as flushed complexion, inflamed eyes, headache, and even bleeding. If Qi descends inappropriately, blood also sinks, producing abdominal distension with rigidity or melena and metrorrhagia. The third is stabilizing blood flow. For blood to circulate in its vessels without extravasation, the stabilizing effect of Qi is indispensable. If Qi fails in the stabilizing action, a variety of bleeding disorders can arise. In clinical therapeutics, these are usually treated by invigorating qi so that its stabilizing action can conduct blood back into the vessels and thereby stopping the bleeding. The actions of blood on qi is that blood is a carrier for qi and conveys it to the entire body. At the same time, blood continually supplies the nutrients qi needs to carry out its activities. This is known as blood is the mother of qi. Because qi is very active and can easily escape, it must attach to blood or fluids in order to remain inside the body. When blood is deficient or massive blood loss occurs, qi may lose this attachment and may scatter. This is known as qi collapsing following massive bleeding. Thank you so much for your attention.
Let's now proceed to diagnosis according to Zhang-Fu organ patterns with the pattern kidney yang deficiency and spleen yang deficiency. Spleen yang is reliant on heat from kidney yang and Mingmen to transform and transport the food and liquids that are consumed. If spleen yang is weakened by the consumption of cold or raw foods, cold drinks or cold medicine, or if the spleen is affected by the accumulation of dampness, the weakening of the spleen will place a burden on kidney yang. This is because kidney yang will have to work harder to heat and support spleen yang. Conversely, a weak kidney yang will not support spleen yang, and this will place a greater demand on the spleen yang, thereby weakening it. Now let's go to its etiology. Spleen yang and kidney yang are weakened by the following factors: cold or damp creating foods, raw foods, cold drinks, cold medicine, physical overexertion, standing for long periods of time, lifting heavy objects, too much sex, invasion of exogenous cold, aging, and congenital weakness. The symptoms and signs: diarrhea or watery stools that contain undigested food, watery stools early in the morning, frequent urination with large amount of clear, pale-colored urine, nocturia or enuresis, aversion to cold, cold limbs, edema, lack of thirst, lumbar soreness, cold lumbar region, sore, weak, or cold knees, impotence, low libido, poor sperm quality, infertility, watery vaginal discharge, mental and physical fatigue, depression, indifference and indolence, poor appetite, disinclination for cold drinks or food, pale complexion, dressing warmer than is normal for the season, pale, swollen, and wet tongue with a white coating, deep and weak pulse in the right one, and chair positions may be relatively weak. The key symptoms here are watery stools containing undigested food, frequent urination with clear and copious amounts of urine, aversion to cold, sore lower back, sore knees, and a deep, weak pulse. For the treatment principle, we warm and tonify the kidney and spleen yang. The acupuncture points to choose from are kidney 3, kidney 7, spleen 3, stomach 25, stomach 36, stomach 37, Ren 4, Ren 6, Ren 8, Ren 12, bladder 20, bladder 21, bladder 23, and do 4. For the needle technique, we use tonifying, and moxa is strongly recommended. For the explanation on the choice of points, kidney 3, kidney 7, Ren 4, do 4, bladder 23, tonify kidney yang. Spleen 3, stomach 36, Ren 12, bladder 20, and bladder 21, tonify spleen yang. Stomach 25 and stomach 37, tonify spleen qi and regulate the intestines. Ren 6 tonifies yang. Ren 8 warms the middle jaw. Kidney yang deficiency and spleen yang deficiency can be caused by the following patterns of imbalance: kidney yang deficiency, spleen yang deficiency, spleen qi deficiency, cold, damp, and in turn, this pattern can result to spleen qi deficiency, kidney yang deficiency, overflowing water, kidney qi not grasping lung qi, damp, phlegm, blood stagnation, Chi stagnation, and Chi deficiency. So to summarize, spleen and kidney yang deficiency has its etiology in chronic illness, excessive sexual activity, exposure to cold after sex, damp retention from spleen deficiency, and old age. Its underlying or accompanying pathology is kidney yin deficiency, kidney Chi deficiency, retention of dampness, fire not engendering earth, earth not damming water. For signs and symptoms, lower back ache, cold, weak knees, chronic diarrhea, puffy face, swollen limbs, cold in the lower back, feeling cold, weak legs, bright white complexion, tiredness, lassitude, abundant clear urination, nocturia, apathy, infertility in women, depression, impotence, premature ejaculation, low sperm count, and decreased libido. The pulse is deep and weak, and the tongue is pale, wet, and with glossy fur. Treatment principle, nourish and warm spleen and kidneys. For the acupuncture treatment, we use bladder 23 to supplement the kidneys, Ren 4 to enrich kidney yin and essence, Ren 6 to foster the original Chi and fortify yang, bladder 52 to supplement the kidneys, stomach 36 to foster the original Chi, Do 4 to supplement kidney yang, kidney 3 to enrich kidney yin and essence, kidney 7 to supplement kidney yang, and the extra point qigong to supplement kidney yang. Needle with supplementation and moxa, these points for severe swelling, spleen 9 and Ren 9 to supplement the spleen, bladder 20 and bladder 25 and stomach 25. For heart and kidney deficiency, heart 7, bladder 15 and pericardium 6. Thank you for your attention.
Let us now go to disharmony of Chi and blood. Since Chi and blood are interrelated by mutual dependence and mutual support, when the ascent, descent, and exiting, entering of Chi are disturbed, blood must be affected. Similarly, any abnormality of blood will affect Chi. The most important patterns of disharmony of Chi and blood are as follows. First is Chi stagnation and blood stasis. When the movement of Chi is impeded and Chi stagnates, blood circulation is also impeded and blood becomes static. This is mainly due to the passions bottling Chi up internally. Stagnation of Chi and stasis of blood are closely linked to disturbance of the liver's conduction and dispersing functions. Blockage of liver Chi produces distension and pain in the chest and subcostal region. As Chi moves, so does blood. As Chi stagnates, so does blood. Thus, Chi stagnation and blood stasis often present clinically with pain, ecchymosis, masses, and swellings. Also, since the heart governs the blood vessels and propels blood circulation, when the heart's function are disturbed, blood stasis may develop and lead to Chi stagnation. Second is blood stasis due to Chi deficiency. In this pathological state, Chi deficiency first develops. Blood stasis results from deficient Chi being unable to propel blood circulation properly. For example, if the heart Chi is deficient, then blood circulation lacks adequate motive force and blood stasis may develop in the entire body. Clinically, there may be ecchymosis and cyanosis of the tongue. In the elderly, abrupt Chi deficiency may occur and lead to blood stasis, resulting in the body and limbs losing their nourishment, and clinically there may be hemiplegia. In therapeutics, whatever its cause, it is appropriate to treat the condition with large doses of herbs that augment Chi and complement them with herbs that mobilize blood and dissolve static blood. Next is failure of Chi to control blood. If the action of Chi to control blood flow is weakened, the flow of blood may not be contained within the vessels. This condition is closely linked to damage or deficiency of spleen Chi. When deficient Chi fails to control blood flow, there may be extravasation resulting in subcutaneous bleeding and ecchymosis. If bleeding occurs in the lower parts of the body, it may be seen as hematochezia, hematuria, or in females, metrorrhagia. Next is Chi collapse following massive bleeding. Since blood is the carrier for Chi, when there is massive blood loss, there is also massive Chi loss or collapse, resulting in deficiency or collapse of both Chi and blood. The main causes of this condition are traumatic hemorrhage, metrorrhagia, and postpartum hemorrhage. Chi collapse lead to prostration of yang. Inability to warm the body and stabilize the exterior can produce profuse cold sweating. Inability of yang qi to reach the extremities of the limbs can produce cold hands and feet. Collapse of both qi and blood results in failure to nourish the head, the eyes, and the orifices. This may produce syncope. Because of the collapse of blood, the pulse is hollow, or it may be deep, thread-like, and indistinct. Next is deficiency of both qi and blood. This is a condition of simultaneous deficiency and impaired actions of qi, and deficiency of blood with diminished nourishment of all the organ systems of the body. It is mainly the result of chronic illnesses in which qi and blood are both consumed or damaged. In some cases, there is loss of blood first, leading to reduction of qi. In other cases, there's qi deficiency first, so that the sources of blood generation become compromised. The clinical symptoms of both qi deficiency and blood insufficiency are pallid or sallow complexion, shortness of breath with apathy, lassitude and weakness, emaciation, palpitation of the heart and insomnia, dehydration of the skin, and numbness of the limbs. Thank you so much for your attention.
Epigastric pain. So we discuss eating habits that cause stomach disorders. Chinese medicine culture places much emphasis on the conditions of eating as on the nature of the foods eaten. The stomach is the main yang organ, and all yang organs fill and empty in a rhythmical fashion. The simple questions in chapter 11 says, the 6 yang organs transform and digest and do not store. After food enters the mouth, the stomach is full and the intestines empty. When the food goes down, the intestines are full and the stomach empty. For this reason, Chinese medicine stresses the importance of eating according to a routine, with regular meals taken at the same time every day and similar amounts for corresponding meals each day. It also stresses the importance of eating a good, substantial breakfast and lunch and only a light evening meal. Very many people, either because of habit or pressures of work, eat in very irregular conditions. The importance of having regular meals is very clear to diabetics, who know that they must take the utmost care in this respect to keep a balance in their blood sugar. Similarly, normal people should also have regular meals to maintain a good balance of blood sugar throughout the day. The main eating habits that cause stomach disorders are as follows. Eating too fast or on the run. This causes stagnation of qi in the stomach and retention of food. In a person who has eaten in this way for many years, the stomach pulse on the right middle position, just slightly distal to it, or towards the thumb, feels quite tight. This indicates stagnation of food in the esophagus due to eating too fast or on the run. Eating on the run means eating a quick sandwich while working, or eating one's lunch in just a few minutes, or eating while driving. Eating late in the evening or night. Evening and night times are times of yin predominance. Eating at these times will therefore use up stomach yin rather than stomach qi. For this reason, it causes stomach yin deficiency. This may manifest on the tongue with a wide midline crack or scattered cracks. After many years of eating late, the tongue may lose its coating completely. On the pulse, stomach yin deficiency may be felt with a floating empty and soft quality on the right middle position. Discussing work while eating. This is a very common habit in modern industrialized societies where a lot of business is conducted during business lunches. This also causes stagnation of qi in the stomach, as the stress of business impairs the proper function of the stomach and spleen. Going straight back to work after eating, this causes stomach qi deficiency. Eating when emotionally upset, this causes stagnation of qi in the stomach and liver, and in some cases, also stomach heat. This is sadly an all too frequent occurrence in many families, where meal times are an opportunity for family rows or stony silences. In children, this can affect their digestive system for life. Eating irregular amounts from day to day. This happens, for example, when one eats a large and rich business lunch one day and skips lunch the next day. This causes stomach qi deficiency. Not eating breakfast. This is probably the most important meal of the day. The stomach is its peak of activity between 7 a.m. and 9 a.m., and it is therefore natural to have a substantial meal in the morning. Breakfast also provides nourishment to sustain us throughout the day. Not eating breakfast causes stomach qi deficiency and also blood deficiency in women. Constant nibbling. This causes stagnation of qi in the stomach and retention of food. because the stomach needs to be filled and emptied at regular intervals. Eating while reading or watching TV, this causes stagnation of qi in the stomach and retention of food because reading diverts qi away from the stomach to the eyes. It is also often a cause of headaches on the forehead. A sudden change in dietary habits. This happens, for example, when a teenager moves from home to college or when work circumstances change, forcing a change in dietary habits. These sudden changes are very frequent causes of stomach disorders and epigastric pain. Fasting may be beneficial in those who have an excess and heat condition of the stomach, manifested with a full and slippery pulse and a thick yellow tongue coating. In most other cases, complete fasting on water or juices can weaken the stomach and spleen and lead to stomach qi deficiency. In particular, those who already suffer from stomach and spleen qi deficiency should not use fasting as a method of self-treatment. Eating too much at weekends. In most countries, people tend to eat more at weekends because they have more time to cook and relax. From the Chinese point of view, this is not beneficial, as it is actually appropriate to eat more during the week when one is active and needs the fuel provided by food, and less at weekends when one is usually less active. The following case history, although not related to epigastric pain, is a good example of irregular eating. A 42-year-old woman suffered from diabetes. When she came for her consultation, it had just started and she was not on insulin. She was keen to avoid starting insulin. The diagnosis of stomach and splenium deficiency was made and was given Chinese herbs. Normally, if treatment is given straight away after the onset of diabetes and before insulin is started, this disease can be controlled completely. However, in this case, after 6 weeks of treatment, she was no better and had to resort to insulin. The diagnosis was rechecked, the principle of treatment and decoction used, and could not understand why it had not worked at all. The diet was discussed with her and told her what to eat. However, asking her was overlooked about her eating habits. This turned out to be the worst possible. She was a sales representative, and her job involved during the whole day to visit various clients. She had no breakfast in the morning and left home in a rush. She did not have a proper lunch because she had no time for it, and this often consisted of a sandwich, which she ate while driving and under great stress. She returned home at about 9 in the evening and was far too exhausted to cook, so that her evening meal consisted of a frozen TV dinner cooked in the microwave and eaten while watching television. It should also be added that to combat tiredness, she drank vast amounts of coffee every day. Her diet and eating habits provided the answer as to why the treatment had not worked. On reflection, it had been a mistake not to ask her about her eating habits before in order to advise her. This is very important to do, especially in cases of stomach and splenium deficiency. Thank you for your attention.